For many men, the real fear of prostate cancer isn't dying. It's this: will I have an erection again? Will I leak urine? These fears are not irrational, but what most patients are not told clearly is that decisions made before treatment may dramatically change the odds. Let's look at what medical evidence actually says. Prostate cancer treatment can save your life, but it can also affect the quality of life. The two side effects men fear the most are erectile dysfunction and urinary incontinence. Some men never recover, but some may as well do. The goal of today's medicine is to help not just survive the prostate cancer, but to survive it with the least side effects and with unnecessary regret. Before we start, huge thank you to the community. Hundreds of men are sharing their experiences and helping each other navigating their disease. This openness matters, and I'm deeply grateful this message is resonating with so many. Let's start with the side effects most men worry about: erectile dysfunction. The nerves responsible for erection run along prostate in these tiny structures called neurovascular bundles. These nerves are extremely delicate. They look like a hair. During modern prostate surgery, surgeons will attempt to separate these delicate nerve bundles from prostate tissue and perform a so-called nerve-sparing surgery. This is done whenever cancer allows it. In fact, major clinical guidelines recommend performing nerve-sparing surgery whenever it is possible and safe for the patient. In many other instances, the nerve-sparing surgery may not be possible due to tumor spread. But reality is, even if the nerve-sparing surgery is performed perfectly, those nerves do get damaged and the function is not maintained. This is called neuropraxia, which is essentially a temporary shutdown due to the surgical trauma. Recovery in this instance can take 12 to 24 months, but there is recovery. And here is important number many men are not told. In large studies following men after prostate surgery, only 20 to 30% of men regain the erectile function strong enough to maintain intercourse without medication. On the other hand, many men can achieve erection with medication or other strategies, while younger men who had a strong baseline erection before surgery generally tend to recover their function better. But the reality is this: erectile recovery after prostate surgery is often unpredictable and may be incomplete. I have men in my clinic who were never told this before the surgery and are completely blindsided by these side effects. This should never happen. Now let's talk about the second major fear, which is urinary incontinence. Prostate sits just below the urinary bladder, encasing the urethra. Right below it sits the most important muscle for bladder control. It's called external urinary sphincter. When the prostate is removed, this system is temporarily disrupted. So when the catheter goes out after surgery, men may experience leakage of urine, especially when standing up, coughing, laughing, etc. This is called stress urinary incontinence. The question though is not whether the leakage occurs early, it's whether the leakage stays for the long term. With modern surgical techniques these days that preserve the sphincter function and the length of urethra, the large studies show that 80 to 90% of men are able to regain the social continence within a year. That typically means no pads or one small security pad, but recovery varies. Some men recover faster, some men take longer to recover, and in a group of men, the urinary leakage stays until the end of life. This is why surgical technique and experience of surgeon matters tremendously. Another important fact many men are not told is that recovery is not passive. There are strategies that can improve the functional outcome. For gaining urinary continence, the most important intervention is the pelvic floor exercises called Kegel exercises. However, many men perform them incorrectly, and we need to be working with a specialized pelvic floor physiotherapist, ideally before the surgery. This strategy can significantly shorten the recovery time. For erectile function, we often use something called penile rehabilitation. Because erections may not occur naturally while the nerves are recovering, penile tissue may not receive enough oxygen-rich blood. To maintain healthy tissues, we often prescribe medications such as tadalafil or sildenafil in low doses. These medications may not immediately help you recover your erection, but they help to maintain that healthy blood flows while the nerves recover. The major clinical guidelines emphasize something extremely important. When choosing the prostate cancer treatment, doctor and patient must consider two things: the risk posed by cancer itself, how dangerous it really is, and then the possible impact on urinary and sexual function. In other words, treatment decisions should never be made in a rush, because what we choose to act on now may shape your life in the future for the rest of your life. The goal is not to simply treat cancer. The goal is to select the right strategy that fits your cancer and your life priorities. I know how overwhelming these decisions may be. If you are still early in the process, whether checking for PSA or getting ready for a biopsy, I created a free printable checklist you can take to your urologist to ask questions before your biopsy. You can download it in a link below. And if you are trying to understand PSA results and biopsy decision making on a more organized level, I also created a paid optional guide about PSA. Everything in it is free in my videos. The guide just organizes it. You are able to print it out and organize your thoughts. You can download both in the links below. I want to end with something important. For many men, losing a bladder control or erectile function may seem like an attack on their man identity. But you are not alone. Even if the function recovery is not going well for you, there are ways medicine offers for help. From medications and devices to procedures like artificial urinary sphincters or penile implants. There's always another step you can take forward in order to improve your quality of life. It's possible. If this video helped you understand these decisions more clearly, please consider subscribing. It also helps the information reach other men who are facing the same decisions. And if you feel comfortable, share your experience in comments. Your story may be exactly what another man needs to hear today.